Hi, team. Welcome to 10 Talk. So, Mark and I are on the journey to help you really live your best life. And today's discussion is all about depression in athletes, certainly CEOs, high achievers in business and sports, our life athletes. We really just want to talk about what happens when we're taken off of our game and we really struggle inside physiologically, emotionally, socially, something that we don't seem to be able to figure out. And I think there's been so much discussion about depression, and I'm very grateful that Mark is on our team and able to really take us through just the medical side of it, what's happening, and we'll get coached up on what to do with this. So, Mark, thank you again for being on our team and just the joy of the journey of serving and supporting. So, here we go. Let's talk depression.
Absolutely. Thanks for having me. You know, uh, Depression is not exactly the most fun topic to talk about, but very important because it can happen to anybody. It's any culture, race, gender, whatever. And athletes are human. And so by design, they have the exact same prevalence rate of depressed mood as the general public does. That's a really important thing to notice because for years, especially athletes that reach the elite level, a lot of people would think that it's almost self-selective once you get to that place that you wouldn't necessarily have as many of the same life stressors as other people or deal with mental health concerns. Fact is that's not right. Also, it's been stigmatized for a long time that it's been a lot easier to talk about performance rather than stressful life events and disorders that athletes do have. So that's where the field of sports psychiatry sort of was born and why we're talking today. Depression is not just a fickle change of mood or where your mood drops after a bad event or a game or poor performance or anything like that. It's actually when it's sustained and you have low mood for at least 2 weeks or irritable mood, and it comes with a whole host of biological symptoms that are up too. So the clear difference, you're not just sad. It's sadness with loss of interest in things you typically enjoy that persists, where you're having unfounded guilt about things that are occurring in your life. You're having low energy, low motivation, poor concentration, different changes in appetite, changes in sleep, slowed psychomotor movements. I'm basically just going through the DSM criteria right now. But the fact is, you only need about 5 of those 9 characteristics to meet criteria for a major depressive episode. And the hardest thing is actually recognizing when it's happening, because the person themselves that's depressed is probably the last person to know. So really, when it comes to talking about depression, we really first need to talk about screening. Then we can talk about like what's actually going on, and we can talk about a treatment. So I think these are as far as like winning strategies. First one is screening. Involving an athlete's entourage, which would include, athletic trainer, their family, their peers, the coaches, is super important. So first, educating them on what's going on with depression, what it actually is important so they know what to look for. But incorporating screening for mental health conditions as part of the pre-participation physical. So we're going to involve the mental with the physical. We had talked about that in the eating disorder discussion. But that's really, really important. So making that, just normalizing that we're going to talk about that as part of that pre-participation exam is important. So you would go through those criteria. There was actually a specific screening tool developed for athletes, a couple of them. The first one being the Barron Depression Screener, named after a sports psychiatrist in California. And it's a very generic 10-part screening tool, and where you really only have to score a 5 out of potential many points. We'll make sure we get a link to what that actually is. But that's one thing that you could use. Another is the Athlete Psychological Screening Questionnaire, or APSQ, which is a part of this other gobbledygook acronym, the Sports Mental Health Assessment Tool that we had talked about before. Anyway, there are some actual objective things that you can use to screen for it, rather than just having a discussion and trusting that you, the layperson, knows what's actually going on in this person's life. As I've said before, mental health conditions are invisible injuries, and so they don't just scream, "Hey, there's no light that goes on when someone is depressed." You have to actually kind of pay attention. So things to watch out for would be, say you have an athlete who is typically a really high achiever on the field, but they're starting to have like an immediate kind of performance dip, or they're not really as interested in coming to practice, or really they're starting to become late, or they're dragging, or simply not seeming like themselves. See, these are some red flags that you should be able to pick up. So when you see them, what do? You would very calmly, take them to the side after practice or during a break in practice, just to check in on them and ask them how they're doing. One of the biggest misconceptions about depression and other related illnesses is that if you talk about the problem, you're going to create it or make it worse, when in fact you're actually giving them the space to talk and share how they're actually feeling. And so recognizing that changes in even how they're doing on the field can be looked at is just as important as they're off the field. So off the field stuff, maybe they're in class, they're not doing as well academically, or they're not attending to family activities, or some of their duties that they would otherwise have at home, or maybe they've developed a substance use issue as a means of maladaptive means of coping. So again, changes in personality or behaviors are things to watch out for. After that, getting the person help is going to be kind of the primary rest of this talk, but I'll stop and see if you have any feedback.
Well, I really want to talk about the well-being of our human. So whether we're an athlete, whoever we are, from a human perspective, something's going on. And you said something that I really value so much, is that if I'm depressed, I'm the last person to know it. So I really value being able to have these kind of indicators that are showing up. Wow, I'm really different. And also I heard that it's different for a prolonged period of time, for example, 2 weeks, because from a well-being perspective, I think that we're very in tune to, my gosh, I'm not feeling good today, or I'm not feeling really strong, I need a well-being day. And instead, I want to unpack how we really honor that there is the stress of pushing through things to be able to really maintain that level of performance and getting things done, and also respecting that if we're depressed, it's going to be much harder to do normal things, kind of the everyday things. So from a well-being perspective, if I am the last person to know I'm depressed, but I'm recognizing that I'm showing up different, I don't really feel like going to practice, what's the difference between maybe burnout or just kind of struggling versus depression?
So burnout's that's a really good topic. It comes as a result of what we call overtraining syndrome, which has basically the same symptoms that we would see with depressed mood. And it's if you think about it, the athlete's identity, being someone who's involved in sport and that being their primary interest, that's a core feature. And when it's being challenged in some way, either whether or not they can't perform as well as they used to, or they got injured and can't perform, or what have you, when that's being challenged and that's their only real means of coping, that can become a problem. So a lot of times when someone's really stressed and they're an athlete, is that they'll just commit even more to the sport and train even further, and that leads to a perpetuating cycle, where it can lead to burnout. So, and we had talked about something called the relative energy deficiency in sport when we talked about eating disorders. It's the same sort of concept. And when you really just exhaust yourself and expend in the eating disorder world too many calories, and you're not fueling yourself with enough nutrition, but otherwise, if in overtraining, when you're exhausting yourself but you're not fulfilling yourself with adaptive coping strategies or something outside of sport, you have an issue. So OTS, or overtraining syndrome, is real, and the only real way to address it is to take a break, and to in a healthy way help the athlete basically broaden their perspective and look for things outside of sport that they enjoy, and think about themselves as their identities more than just the sport itself, so that they can use other things to help them when they are stressed out.
So, Mark, in our coaching, it's a three-dimensional model. We coach personal, professional, and philanthropic. And it
Mhm.
came from sport. I was an athlete and really being that one-dimensional, high-achieving boy. If I won, I thought I was a winner. If I lost, I thought I was a loser. And that's brutal when your whole identity is attached to your performance. And so really the gift that I got through that struggle was this coaching model that we have, which is three dimension. And really figuring out, who are you personally? What's for significance to you? And that's where we put our well-being, like our relationships and what we're doing for rest and recovery, really what we're doing away from sport. Is it fulfilling us and is it helping to really re-energize us so that we come back to our profession for success, ready for competitive greatness? I mean, really ready to compete and do great. And then philanthropically, just giving hope, really getting outside of me and connecting to something so much bigger than myself. And so I love hearing you talk about the value of really that whole person development, because that's a thing to really develop who we are. As an athlete, we start training to be a great athlete very young, 7, 8, 6. And so one dimension is completely the focus of our family, of our, school. Everything is, here's our athlete, how's the athlete doing, what's going on in the games. Nobody's really asking me about who I am as a person. So as we talk about the well-being, really being able to develop a life outside of sport that is anchored in, what do I like, what's important to me, what fills me with joy, what's important. And that's a whole thing. Like, we have to train as intentionally to be great at our life as we do at sport. And I think that can be a little bit overwhelming to an athlete who's like, well, wait a minute, I've put everything into being an athlete, and now you're telling me I've got to figure out something else. I don't even know where to start. So when we talk about the well-being, I really am excited for the athlete to understand the value of developing themselves personally, holding themselves accountable to joy, friendships, relationships. And you talk about taking a little time off, or really thinking about the rest and recovery component. Sometimes that can bring more anxiety and actually hit into the depression, because we're coming off of the high of performing and being around people and just showing up, and that excitement that other people actually get me going rather than me getting myself going.
You're exactly right. Because when you're taking a break, or say someone's retired, that that lack of participation in sport is multifactorial. It's been part of their identity. It's also the sport itself, and exercise as medicine. You're kind of eliminating that because they're not, used probably performing at such a high level. So we're again replacing it with something more adaptive that they enjoy is the key. The rates of depression in general in the public is around 8%. Same with athletes, and the highest time in retirement for a depression to erupt is around 2 to 3 years after they've left sport. It's like really kind of hitting that rock bottom of, okay, figuring out who am I, and figuring out how to move forward. So a key feature of therapy and coaching, as you mentioned, is figuring out who you are outside of sport. I think that's brilliant.
Let's talk about taking that time off in terms
Yeah.
of really resting and recovering. When you're depressed and you're taking time off, is that for you? Like, again, just really understanding that, does withdrawal or isolation help in the recovery or hinder the recovery? Like, how do we do this?
Yeah. So socialization is a big component of recovery from depression to make them feel part of community. And remember, the person who's depressed is most likely the last person. No, so making sure that their entourage is involved with helping them stay socialized, especially if they're no longer involved in the team. If it's a team sport, in fact, again, this is a great segue. Folks that participate in individual sports are actually more prone to depression than team sports. Well, there's a lot of reasons maybe to think about it. Maybe it's the person that chooses to go into an individual sport may have been more prone to depression in the first place. I highly doubt that, but I think it's actually the team concept of the diffusion of responsibility of when something goes wrong, that they're less likely to sort of have that perfectionistic quality that, like, I was the one responsible for why things didn't go well, and then turn it inwards and make it negative. But in a team sport, and if they're no longer able to be part of the team because they're not actively playing, you still want to have them be involved in something. So socialization is huge. The treatment of depression is multifactorial, because the longer it goes on, one episode, the poorer the prognosis. So you really want it to identify quickly and address it quickly. Because it tends to be recurring and remitting, like that, with multiple episodes. It could be a single episode and you're fine, but the earlier that it happens and the longer it lasts, typically it's more problematic.
How would I know I'm having an episode, or how long is an episode before I
Yeah,
start
so an
having
episode's
more
at least
episodes?
at least 2 weeks, and then
Okay.
if it persists. I mean, major depressive episodes can last just a few weeks or many months.
Okay.
It really depends, and then there might be a return to former to typical functioning. The issue is, a lot of times folks that are depressed or have been in such a long depressive episode won't know which way is up, so that when they are actually feeling better, they'll think that they're feeling too good, because feeling depressed will have become part of their identity at that point too. That's a separate discussion.
That's an
But
interesting one, though. We're going to come back to that, because that's that habit, right, of kind of just, what am I feeling? And yeah, well said. Okay.
yeah. So I like to think of the treatment of depression as socialization, a healthy focus on nutrition,
Okay.
focus on therapy and treating new adaptive coping strategies, and then meeting with someone like me to help sort of evaluate the whole situation and make appropriate referrals, and potentially considering medication if it's warranted, if there's a lot of biologically driven depressive symptoms that just aren't moving. That's where medication could potentially come in. As far as nutrition, which is one of my favorite things to talk about, there's nothing better than the Mediterranean eating pattern. I'm phrasing it that way. It's not a diet; it's just a way in which you eat. There's a fabulous book called "This Is Your Brain on Food" by Dr. Uma Naidu from MGH, and she actually writes on how to adapt your dietary pattern to different mental health conditions that might be going on, as a way of optimizing. It's not a treatment. Yeah. It's just a way to maybe optimize how you're eating so that your body can respond and battle whatever you're dealing with. As far as depression, that Mediterranean pattern is huge. So thinking about omega-3s, and things that are foods that are more likely to be probiotics or prebiotics, using things like turmeric. I mean, seriously, like, not going to hurt anything. Certainly would be better than if you're depressed and you're going towards fast food. Like, the person who's depressed probably won't be eating very well, and so you want to get your gut biome reset. So that's one aspect of it. The therapy component and teaching with skills that goes along with socialization, meeting with a mental health professional who can guide you and walk you through how you're feeling, and sort of combat those negative cognitions that you have going on that's in that depressive state, is huge, and reframing it. And there's so many different modalities of therapy that could be used, but it can be tailored to the individual, which is why you want to meet with someone who's not just a one-trick pony. But then having a coach who can help really guide you on all of the stuff outside of sport, I think is beautiful. So that's wonderful. As far as medication options, there are different things that could be used depending on the situation. And I mean, I can go into detail, but it really depends on the person. And you've had to have a pretty good family history that's been collected. And so getting collateral information, or basically info from people that know the athlete well, is paramount, because the athlete, when they're depressed, probably isn't going to be the best reporter. So talking to their coach, talking to their athletic trainer, talking to their family, and figuring out what their normal level of functioning is, and a little bit more about them in that context, is hugely important with developing a treatment plan that's going to work.
Mark, do you find that people just want to be able to take a pill and get over this? And is that something that people come to you with to kind of start with the pill, or where's the starting point? I guess medication's a better word than pill.
Well, but the way you phrased it is the way that a lot of people will look at it. And so, yeah, the I want it now mentality this, with this day and age is huge. But you can't expect that just taking a medication is going to address the rest of your lifestyle. So unless you look at the whole picture, not everything is going to get better. Certainly, there are some medications that can be incredibly helpful with lifting your mood to in sport, performance affirming. So getting you back to where you were because the depression is no longer holding you back as much, so that you aren't staying in bed all day and you have a little bit more energy and you aren't feeling as terrible about yourself. Like those, that actually could be addressed. But if you're just doing that and you're not looking at your sleep patterns or or ways to get socialized or actually talking through some of the stuff that's been dragging you down and some of those precipitating factors to the depressed mood, then you're missing the point. That you can't expect things to be good for forever.
So, Mark, we call that the power of team. I mean, you and I are teaming up right here just for that example that we need each other. I mean, it's really great for each one of us to specialize in what we love and what we're passionate about and been educated in. And the joy of connecting to teammates and being able to have this team around us medically in terms of socially, mentally, emotionally, as intentionally as we do in sport. I mean, that's the beautiful part of it. You don't just want to go play volleyball and you have a head coach. You have associate head coaches, you have a strength trainer, you have a nutritionist, maybe you have a life coach, sports psych. I mean, wow, if we're going to do that to win at sport, why aren't we doing that to win in our lives as intentionally? Because we bring this same human machine with us everywhere we go. And thank you for just the words of wisdom of we need all of it. We really need to be able to totally respect that we may need medication to rewire our brain and to do some very biological, intentional things. Just like if you've got the flu or anything else, you're going to need some medication to help with that. And then we have to step in from a heart perspective and for our life and really be a champion for us and get that nutrition that we need to feel good and get a person on your team that you're talking to, a coach to really work you out and how you're going to start living like this rather than just being it. And I do want to talk about the wiring of the brain or kind of those habits that we get into, because you mentioned that actually depression can feel normal and feel like kind of what we're supposed to feel. I think there's a lot of curiosity around that as to like, what's the right way to feel? And am I depressed? And, like, what are some ways that a person could really, I know we talked about actually taking the test and understanding that, and also just starting to self-advocate and understand, okay, I need to be my own champion here. I need to be for me. How do I recognize when I'm not feeling that good, but that's okay because maybe there's something that's gone on in my life and I need to actually do the work on a grief or a loss or something that's happened rather than just medicating over it.
So a couple of thoughts. So clinically significant depression causes functional impairment in someone's life. So there's a clear change in how they go about doing something from during the depressive phase and pre, and then hopefully post. So that where they're not doing as well socially, academically, whatever.
Yeah.
So there has to be a clear change. And so, and in some ways, think about when someone's walking around with dark colored sunglasses on and they just aren't seeing the world the same way. And then when their depression's treated, they've taken the sunglasses off and they're actually starting to see things in bright, cheery colors as they used to. I mean, it's a metaphor certainly, but that's kind of what we're dealing with here. When someone's depressed, they aren't going to know how they're feeling, and the athletes specifically have been told over and over and over to quote power through their physical injuries and play injured and whatnot, and they then don't accept the fact that maybe what they're dealing with is more of a lull caused by depression, and that they should just keep going through it or even talk about it. So that's huge.
So the habit of actually wearing dark sunglasses, to use that metaphor, if I'm keeping my sunglasses on all the time, that becomes my norm. And how do we take off our sunglasses?
So it's hopefully with some education, people will start to know what to look for, right? And if you don't like how things are going, you can't continue to do the same thing and expect a different result. And so reaching out to your trusted friends and colleagues, people who know you well, and asking them, hey, am I doing okay? What do you think? You know me pretty well. And hopefully getting honest feedback from them. that if these are your true friends and family members, that they'll actually give you that honest feedback. Like a coach would be a perfect person to give you that feedback. Like, no, I've actually noticed that XYZ has been happening with you on and off the field. Yeah, that would be a great starting point. But sleep tends to be the first thing and the most important thing to address. If you're noticing a change in your sleep pattern where you're waking up a lot earlier than usual and you're not getting restful sleep, and or you're waking up a lot in the middle of the night, or you're not able to fall asleep, that is a key indicator that something's going on. It might be just stress induced or anxiety, but if it's persistent, that would be something that you actually like, okay, I know for sure that that's going on. I probably should ask somebody for help.
Mark, I love those winning strategies from an information perspective, really specific information, being able to, number one, pay very close attention to my sleep. I'm in control of that. I know if I'm waking up or not waking up. That's something that I can be very, very intentional with. And what a gift to go to the people that are on your support team that love you and care about you and say, hey, how am I doing? What do you think? What are you observing? That's a gift of feedback. And so many times we don't want to hear it and we keep faking it. And we're like, we hope nobody's noticing it. And thank you for the gift of just calling that out as a winning strategy to connect to the people that love and care about you and ask them, hey, how am I doing? What do you think? Because understanding that it's a blind spot for me. If I'm depressed, I'm not going to see it. That is just, again, connecting to that support team.
For sure.
So let's talk about navigating through change. So we've taken the test as a coach so that we know we've set our athletes up just like physically we would have them taken care of. We've done the mental test now to really recognize that. From an information perspective, we know we're monitoring our sleep, we're connecting with our support team, we're asking how we're doing. If I'm feeling low for more than 2 weeks, I'm really recognizing that I've hit something different than just having a bad day or struggling through something. And I want to begin to really navigate through the change. So you've talked about getting a support team in terms of you as a doctor, a sports psych or a counselor or a coach, or meaning a life coach or a performance coach, somebody that's really training you as intentionally in your life management as we are in sport. What are some of the things that start to happen when we begin the change and we don't feel like we used to? So that rubber band theory of like actually not having my compass right. Like I actually think feeling depressed is my true self.
So a lot of conversations I had with patients was say they're in therapy, they've adjusted their diet, they're working on their sleep patterns, and they're talking to me, and they just maybe started a medication. Would be, you can't expect that doing all this is just going to staple a smile to your face. It's going to be a gradual change where you're going to feel hopefully more content and less low and less irritable than you had before. And maybe those sunglasses will start to drop and eventually no longer be on your face. And you'll find that you might be then more interested in participating in the activities that you used to and be able to return to sport. And then that actually creates good habits. And so those good habits build on each other. And then eventually, at some point, hopefully within a few months, you'll be able to return to where you were, which the value of retrospective view, once you've recovered, you'll only then will you be able to recognize, oh wow, I had really dipped low. That was a tough period, and I also know some of the warning signs at that point. So the value of perspective there will be very helpful to prevent a future event from occurring. So that would be kind of what I would say about that.
So how long do we give ourselves to really recognize that? Is it just like every day I'm kind of noticing, am I adding one, I'm kind of pushing myself to do one more thing? Like I think about the dear friends that I know that have struggled with depression, and it's like, I don't want to get up today. Like, leave me alone. Like, no. So is there kind of a training schedule that we can put us on to where it's just try one thing a day? Or like, I really want to balance. I know as athletes and high achievers, we push through everything. And I want to introduce not doing that and being very honoring of who we are.
Yeah, trying to do everything all at once, that movie title or whatever, it doesn't work out. So expecting yourself, I mean, give yourself some grace. You're not going to be able to jump right back into the thick of high performance competition the day after you've been diagnosed with major depression. Like, that's just simply not going to happen. So having a very, very gradual return to play idea, return to life, would be very healthy. So I think I like your idea. One or two goals, and being very, very concrete about it, actually writing it down. Don't just say, oh, yeah, I'm going to do that. And no, write it on paper. There is something to putting on a paper and keeping you accountable, and maybe putting it on your fridge, and working on, I would say, start with the easiest stuff first: sleep and staying on a schedule throughout your day. Even if that means I'm going to move from my couch to the park bench outside once a day, like, versus sitting in front of the TV. So that's like step one. And I'm going to then go to the gym, and then I might just be socializing at the gym, and then I might actually do something at the gym, and then so building on each thing. And that's where actually using a coach like you to develop that winning strategy would be useful, because it can be, again, concrete. And I forget that acronym, but it's where it's actually a doable strategy. So
yeah, it's all about actually the little things add up to big improvements. And so many times we want to skip right to big. And that's the gift of sports. We recognize day in and day out training. And what we like to do in life management is really talk about, when you go to the gym, the sports gym, and work out, you work out, you lift weights, but you don't leave there and be like, oh, I'm completely a different person. In fact, you don't even see the change until you, day in and day out, you've been going to the gym, you've changed your eating habits, right? There's so many things. And then you just kind of notice this little change, and then that gives you a little encouragement. So it's, again, the same thing, just really valuing the journey and getting some people on it with you that are giving you hope and support rather than judgment or shame or, all that tough stuff. As high achievers, we want results immediately, and we want to demand the best from ourselves. And what a gift to hear you just take us through really how to win life, the well-being, the information, the navigating through change, and knowing that this is a journey. We've got people like us that want to be on each other's support team and are here to help set us up and navigate change.
Yeah, I mean, athletes are perfectionists, typically by nature, and they expect that they're going to be able to do everything by themselves and on their own, and that they got to where they are because of all their efforts. But when you're depressed, and it's hard for you yourself to trust the process, and so actually having someone working with you in tandem to keep you accountable, that you can trust that what you're doing is actually providing those small benefits is really the answer. And then eventually you will get to the point where you're recovered and looking back and having that perspective. So,
well, Mark, I really thank you for the film component. In sports, we watch our film all the time and we learn from it. What a gift to be able to take film from a depressed season of life, whether it's 2 weeks or 3 weeks or whatever it was, and really value it and be able to watch your film and say, okay, what started this, and what actions did I start taking, and what can I now notice as a ritual and routine that happens for depression, so that I can be different when it shows up again rather than not notice it.
Yeah, no, I love that. Yeah, that's exactly right. That's what therapy can be. It's essentially, film work, and then adjusting and developing a healthier strategy moving forward. So for greater success.
Any words of wisdom?
Just know that depression can happen to anyone. It is absolutely treatable with the right approach. That people do improve, but it can be really mean and isolating, and get you to a really dark place where you don't know that it's going on. So activating those people that care about you is super important, and really making sure you're sticking to the basics: healthy sleep, healthy schedule, healthy diet, but then actually talking about it and not suffering in silence, because while it is an invisible injury, it is treatable.
Thank you very much, team. It's up to you. Go out and win your life. Know that you've got people like Mark and I on your support team. And I just love the fact that we need each other. What a gift to own that we are stronger together than we are by ourselves, isolating, and go out and practice winning for you this week. Thank you, Mark.
Thank you.